Good evening, and thanks so much for joining us for this special episode of the Pause for the Truth podcast. I'd like to start by thanking the hosts of Pause for the Truth, Dr. Rogers Kane and Ms. Jocelyn Turner, for yielding their platform for this evening's important conversation. I'm Dr. Kelly Tice, and I'm the president of the Northeast Florida Medical Society. The Northeast Florida Medical Society is an organization of minority medical professionals who are committed to improving the quality of medical care in the North Florida and South Georgia region. Our organization provides a common forum for our member medical professionals to promote excellence in the practice of medicine in our area. Physicians, advanced practice registered nurses, physician assistants, podiatrists, and other clinical providers who are watching us tonight who are not members of the Northeast Florida Medical Society are invited to become members of this organization. When you do so, you are joining a community of medical professionals seeking to increase awareness about preventable complications of chronic illness and to help members of disparate communities successfully adopt healthier lifestyles. Go to anyfms.health and click join to enter your name and clinical credentials for membership verification. Any FMS members, new and old, we are counting on you to lead the way during our week of giving, which kicks off tonight, our week-long fundraiser for our Northeast Florida Medical Society Foundation scholarships. To the community members, likely the faithful audience of Pause for the Truth, thank you for being here. We hope you will learn something tonight about the importance of minority representation in medicine that you will share in your circle of influence. We invite you also to give a donation today. Join the medical professionals in this community in raising the $25,000 we need to provide scholarships to minority high school students who wish to pursue a career in healthcare. You'll see our goal posted and the link to give throughout our conversation tonight. Thank you. As I said, tonight's panel discussion kicks off the Northeast Florida Medical Society's Week of Giving. Because we are raising funds for our annual scholarship, we decided to focus tonight's discussion on minorities in medicine, why it's important, why challenges exist for minority physicians, and why we as an organization are working to ensure adequate minority representation in healthcare. Tonight, I'm joined by two physician colleagues, members of the Medical Society, whom I hold in high esteem. In fact, both of you, I have actually received care from, and one of you, Dr. Pope, was the pediatrician for my children for a period of time, the highest compliment I can pay a physician. And of course, Dr. Phoenix, a longtime member of a practice where I myself got my women's health care for a number of years. Thank you, ladies, very much for joining me tonight. I look forward to our conversation. And I'd like to go ahead and get started. Dr. Pope, let's start with you. I'd like for you to take just a moment, introduce yourself, give a little bit about your background, and then let us know why you think representation of minorities in medicine is so important.
Well, good evening, everyone, and thank you, Dr. Tice, for this space. This is a wonderful time right now where we are accepting funds to raise for the scholarship for Northeast Florida Medical Society's foundation, because we want to really impact youth who are wanting to come into a space of medicine. I am a transplant here in Jacksonville, Florida. I am originally from Memphis, Tennessee, and I moved here way back in 2007 and was just new to the area, but coming into the organization of Northeast Florida Medical Society gave me a big bright light of faces that I could see like myself, those that were like-minded. I went to a historically Black university, Dillard University in New Orleans, Louisiana, and then I transitioned to a predominantly Caucasian medical school in East Tennessee State, which is in Johnson City, Tennessee. Most of you all have not heard about the city, but it is in the mountains in Tennessee, and there are only 2% minority there. And I'm not saying 2% African Americans, I'm saying 2% minority. So it was a shocker for me, as well as a opportunity to take the wheel and drive it the way that I needed it to go. And then I transitioned back to New Orleans, to Louisiana State University, and I did a residency in pediatrics, which is my passion. And that's why I call myself the passionate pediatrician, because I do love the kids and I love to ensure that they are healthy, so that they can become healthy adults as well. From there, I did a stint for 2 to 3 years, from 2005 to 2008. It's as a emergency room physician. And then I moved to Jacksonville, Tennessee between 2007 and 2008 and worked as an outpatient pediatrician in a private practice, and then transitioned over to the Department of Health in 2010, where I love to see those individuals and those children from birth all the way through 21 in areas that may not get the best quality care, that may not have a grocery store, so might live in a food desert, and that pediatrician. So I like to say that I give quality care to each and every person that walks through my door. Why do I feel that minorities are needed in medicine? And that is because we need to have somebody who looks like ourselves. We need to have someone who understands the challenges, the positives, the ups, the downs. We need to have someone who understands the way that our body works, and just for comfortability. The trust factor as well. We want to ensure that there is minority representation in every field, because we need to make sure that we have people who care about each other and care about investing in the health and well-being of everyone's lives. Me personally, I'm invested in the youth, but again, if I'm invested in the youth, then when I hand those youth off to the adult doctors, then I can feel good about what I did, knowing that they have a good health record going to them. So thank you very much for that question, Dr. Tice.
Thank you. I can't wait. Once we allow Dr. Phoenix to introduce herself, I can't wait to circle back to sort of tie together all of the nuggets you dropped that give us an idea of what a path to medicine can look like for a minority physician. Yes. Dr. Phoenix, let's see if we can capture your audio to let you briefly introduce yourself and talk a little bit about your career path and why you think minorities are important to be represented in healthcare. There's our donation link. Dr. Phoenix, are you able to unmute?
Hello, yes, I'm having some audio and visual connection problems.
Yep, we're having trouble hearing you. Let's see. I wonder if you turn off your video, Dr. Phoenix. And maybe if we just hear your voice as opposed to trying to stream both your audio and your video. Dr. Phoenix, are you able to hear me? Try your audio now.
Let's see something here. Okay, I'm going to try to.
Okay, we're going to ask our producer to work behind the scenes with Dr. Phoenix, and Dr. Pope will move forward. We've all had those issues.
Absolutely.
We completely understand.
Mm-hmm.
Thank you for that donation, Dr. Jones. I see you there. Much appreciated.
Yay.
Thank you so much. Longtime leader of both the Northeast Florida Medical Society and the current treasurer of the Northeast Florida Medical Society Foundation. Nothing like literally putting your money where your mouth is. So much appreciated. Thank you very much. So there was a lot that you said as you described your path to medicine, Dr. Pope. And, one of the things, for instance, that you mentioned was that you started at a historically Black college. Can you speak to a couple of things? And while I realize this may be going off script for a moment, I do think it's important to understand how the foundation that is established for our students that are in STEM, that have set their sights on health careers, how those foundations can be set in academic environments where they feel supported. So you can talk a little bit about your experience and fun at Dillard, and how that prepared you for a situation where you were at a predominantly white institution for medical school.
Yes, I sure can. Dillard University prepared me so much so that it gave me the confidence in who I am today. Although it was or is a historically Black university, it gave me opportunities that took me outside of the box. I was able to utilize summer programs that took me to Fisk University in Nashville, and also took me to the University of North Carolina in Chapel Hill, dealing with health programs. And this is something that I always advise youth to do: reach out, do summer programs, do summer internships that you may be interested in. But it took me outside of the box to work with a different geographic and diverse group of population to give me the confidence to say, hey, you can do anything you want to do. Think about what you want to do, put it in your hand, and just throw it out there. Working at Dillard University, also in the cafeteria, gave me a chance to learn how to speak to people and converse with them and learn how to hold conversations to the point that I ended up becoming the SGA president, learning how to run an office, run a meeting, also working with different people in different backgrounds. So we had a health and Jewish relations organization at Dillard University too, one of the only ones at that particular HBCU. So I got a chance to meet different people who also gave me different ideas and gave me the confidence to reach out to others and just push forward in what I wanted to do and become a pediatrician. From there and from graduation, I really felt as though I could really shoot for the stars. although my trek was slightly different, I did not get into medical school on the first chance. I had to try again, but I was always taught from my family, try again until you get what you want. So on that second opportunity, when I was afforded the opportunity to get an acceptance into medical school, I chose James H. Quillen College of Medicine in East Tennessee State, Johnson City, because I felt like it was a small environment. That opportunity was different as well, and I felt as though it gave me the opportunity to learn different aspects as well. I wasn't in a class of 200, I was in a class of 60, and it was a class that had alternative learners. So there was very few African Americans. It was 6 of us out of a class of 60, but there was also only about 20 individuals that were between the ages of 23 and 27. The rest were older and had not one, maybe 2 careers. So I was in a class with an old veterinarian, an attorney, critical care nurse, a lawyer. So I got a chance to meet and greet with all of these different people and kind of take a little bit of everything from everybody to ball that up into myself. So it was a great opportunity from Dillard forging on to this predominantly white institution as well.
So there's so much that you said, and one of the things I want our young people who will hear these messages to focus on is that it requires being steadfast.
Yes.
And and I've said it to many a student that I have mentored over the years. No one is going to ask what happened the second semester of freshman year, right? No one is ever going to ask. And so when things happen and you have setbacks, and it feels like it's the end of the world, right? It is not. And, we have examples in you and in me, and perhaps even in Dr. Phoenix, where we have the opportunity to overcome a setback. And we can look back now this many years later and recognize how that setback actually positioned you. It set you up for the thing that was next, right?
So and it shapes who you are.
Absolutely. It adds value. It definitely makes you better. So Dr. Phoenix, I see we got you squared away. So we want to hear about your path to medicine and why you think representation in medicine is so important.
Good evening, everyone. I apologize. AT&T wouldn't let me be great, so I'm logged in on my cellular network, Go T-Mobile. Again, my name is Ava Phoenix. I am from Savannah, Georgia. Attended Savannah State University as an undergraduate. And I thought my initial career was actually I was going to be a research scientist. I wanted to actually go into the industry and create different type of medications to help people. So I had already planned I was going to be a drug researcher. My advisor ended up referring me to a summer internship, as Dr. Pope mentioned earlier. I think it's very important, if you're thinking about doing a career, try to get an internship in that area while in college to see if you actually want to pursue that career. So I took a summer internship at the Purdue University in West Lafayette, and I was bored. The experiments ran for like 14 to 16 hours, and I had to go back and draw the lutein off and mix it with another compound. And I'm staring at the wall, staring at the test tube, staring at the wall, staring at the beakers. I was like, oh my God, I cannot do this for a job. Even though my advisor on the campus at Purdue was like, oh, you did a great job. Oh, my presentation was great. But I told him this is not the career path for me. So when I went back in the fall and I told my advisor at the time, Dr. James, and about my experience, and I said, well, I'm like, I don't know what I'm going to do, but I can't do that. I was a chemistry major. And so the Medical College of Georgia actually had a program in the summer called SEEP, and SEEP stood for Student Educational Enrichment Program. And so it was a way for minority students across the state to be introduced to the campus. And you actually took a class, 2 classes in the summer to try to kind of simulate an environment of a medical school class. So I think it was a physiology class that we took. So I met a lot of people from a lot of different HBCUs for the most part. Um, and I took the class. I said, "Oh, I can do that." I never thought that I couldn't be a doctor, but I just had a different mindset going into college. So when I got back, I told my advisor, I said, "Well, I think I want to go to medical school." So at this point, I was a sophomore. And fortunately, in my major, I had the prerequisites necessary to take the MCAT and apply for medical school. So he said, "Okay, well, we'll apply. Your grades are good. We'll see." So literally, I mean, don't follow my example, but I learned. I had a good foundation at Savannah State University. I didn't do any additional MCAT prep. I did study some, but my scores were good. I applied to different medical universities. I did apply to the Medical College of Georgia, as they encouraged us, if we were interested, to apply, as they were looking for students who participated in the program because they were familiar with the campus, familiar with some of the students who were actually going to the school and the environment, and they felt that students who participated in the program had a good transition from undergraduate um, experience to the medical college experience. So when you talked about setback before on the application at the time, they wanted a letter from your dean, and then a community recommendation and a recommendation from a physician. There was actually a segment on the application form for a physician recommendation. So I said, "Oh, well, at the time, the only physician I had was my pediatrician. I was, healthy. I didn't have any medical problems. And, I was A student, volunteer, had a great resume. I said, "Okay, I shouldn't really have a problem getting a recommendation letter." I mean, I've never had anybody tell me no, they wouldn't write a letter for me. So I took my materials there and everything. And literally, that was the first no that I ever received for a recommendation letter. No explanation, just no. So I was devastated. I was like, "Well, I can't believe, I mean, I've been seeing this man since birth, in college, trying to pursue my dreams." And I received a no from the only physician that I knew. Um, so I went back to campus and I told my advisor, and he said, "Well, we'll just get the dean to write the letter. No biggie." But at that time, I didn't know any minority or African American physicians. This was in the early 90s. I was in Savannah, Georgia, so there wasn't a Black pediatrician. There were very few Black physicians in general. So I mean, that was really an introduction to for me, how representation is needed, because that really stuck with me. And so, long story short, he wrote my letter. I got into the places I applied. I chose MCG. And then when we were in freshman orientation, one of my classmates, we were talking about where we were from, and he was saying, I said, "Oh, I'm from Savannah." He was from Savannah. And come to find out that one of my classmates was actually the son-in-law at that point of my pediatrician. So the reason why I found out that he would not write my letter was because he was writing a letter for his would-be son-in-law. So what's for you is for you. But I just found that, the irony of the situation, that, I was not denied my opportunity, even though I didn't get an explanation as a no. So definitely, if you receive a no, no just means moving to just pursue, keep going, but just in a different direction. But, so it all turns out that even with my letter coming from someone else, we both still got into the same class. and we both graduated. At the time at MCG, we had a class of 180 medical students. We had 10 African American students, 3 were male, 7 were female. The majority of the students did attend HBCUs. I think we had one, I forget where our international student went, but we had 2 that went to UGA, 1 that went to Augusta College, and pretty much everyone else went to an HBCU. So definitely, it doesn't matter where you go to undergraduate, you will get the foundation that you need to succeed. All 10 of my classmates, we all started together and we all ended together. We all passed our boards. We all got into the areas of either primary or specialty residencies that we wanted to get into. So definitely, if you apply yourself, find your family, because we were a family. Because sometimes, depending on how the rotation block was set up, you may be the only African American in your block. You may be the only female in your block. Even though the majority of the patients look like you, a lot of times you were the only person on the other side of the white coat that looked like them. So for me, definitely representation matters. So when I have students who need recommendation letters, whether it's nursing, medical, pharmacy, I say, send me your stuff. Send it to me. Because, to me, that could have stopped a student from making it.
Right. Yeah. Yeah. And it's so important that you share that, we exist and we support and we mentor and we write letters and we serve on the scholarship committee and we raise funds because we're trying to eliminate the no that might present the barrier that will keep students coming behind us from continuing forward. That's so important. You covered a lot, and I so appreciate your sharing so candidly what your experiences have been, because I think it's very, very helpful. And one of the things that it brings to mind is how important it is to be able to see in your environment what it is you're dreaming about, and how difficult it can become when you don't see that. And what we strive to do in the Northeast Florida Medical Society is to be that example for students that are aspiring to health careers. And I just want to interject here that for me, I'm the daughter of a nurse, but I am a first generation college student. I went to Florida A&M University undergrad. It was the first place I'd ever experienced being in the majority, ever. Socially, I was a military brat, and had grown up on a number of military bases where they weren't very diverse. And when I stepped onto the campus of Florida A&M was the first time I sort of took a good deep breath, in all honesty. I ended up at University of Florida College of Medicine. But when I was 13, I was sitting cross-legged on the floor in my parents' living room reading Ebony magazine. And there was an article that featured Dr. Alexa Kennedy, the first Black female neurosurgeon in the world. And she was actually featured in a book called I Dream a World. And I will never forget the feeling of her, seeing her brown skin and her scrub cap in that book. It was amazing. It literally was life-changing. It was a very pivotal moment for me. Well, she has an interesting background in that her husband is military or former military. And so when he retired at the end of his military career, they retired to Pensacola. And I have one of those dads. Pensacola is my parents' last duty station. And I have one of those dads that, he is my Northeast Florida Medical Society. He is my mentoring program. He is my, right? And so once I said, I think I want to go into medicine, he used to have a radio show, and he had Dr. Alexa Kennedy on his radio show. Now I'm in med school at this point, right? And the phone rings in the LRC. I still don't know how he did that, but the phone rang in the LRC. I answered the phone, and it's my dad, and he goes, "Hey, Dr. Kennedy, here, talk to my daughter." and he hands me, like he hands the phone off to literally my idol. But it was one of those things. She is down to earth and approachable and supportive and confident in all of us. And in that brief conversation, she brought the bar. She made the bar a little more attainable for me. And so, and what I know and I can say about the both of you, because I now have daughters who are aspiring to careers, that you do the same thing as you hold yourself as the standard for, young women of color who are coming behind you. So I wanted to applaud you for that and share a little bit about the pivotal moments in my academic path that led to this moment. I wanted to talk a little bit about what it is to be a physician in today's healthcare system, to be a physician of color. There are a few things that we have to acknowledge. One is that, and Dr. Pope touched on this, minority physicians are more likely to be in single or solo practices or small practices. They are more likely to care for minority populations, those that maybe could be defined as under-resourced or underserved. And so we already contribute something pretty significant to the healthcare continuum. But the experiences of a Black physician and minority physicians aren't always wonderful. And you've described both in your training and I would assume also in your professional settings, sometimes being in the minority, being the only minority. I want to give you each an opportunity to sort of talk about the experiences that you've had as the Black physician, the Black female physician, the young Black female physician, and how you've been able to navigate that. Dr. Phoenix, do you want to go first?
Oh, sure. That is very interesting in that, now you see more African American females definitely in medicine. But at the time, I did my residency at the University of Florida Health Sciences Jacksonville campus. So that's how I became introduced to the Jacksonville area. And at the time, I was the only Black or African American resident, and I was actually the first female to graduate from the OBGYN residency program. Now, mind you, I matched in 1996. So there were male residents that preceded, but at that time, they had never had a Black female. So it was pretty interesting. When I started OBGYN, it was a lot of white male dominated field. The white or Caucasian female was entering OBGYN, but there was still, as far as attending wise, the majority were white male. And so there was a lot of, there was a lot of haterade against somebody being young, gifted, and Black. I was energetic. I wanted to help my people. And one thing I realized as a resident, especially in OBGYN, we know about the history of obstetrics and gynecology and the African American female and how our ancestors were used as surgical test dummies, if you will, without consent. Research was performed on us. A lot of the early GYN surgeries, the vaginal surgeries, the urogynecological procedures were performed on Black women, really without their consent or permission. I remember the story when I was in medical school about, they called them the kind of like night riders, and that if you were Black, you need to be indoors at night because somebody could scoop you up for a surgery. I mean, I thought that was very scary, but fast forward to my residency program, and part of doing a surgical subspecialty is that you have to have a caseload. So you have to have so many different procedures that you performed and assisted in order to successfully complete the program. And so, I would talk to patients, as the second year, you're trying to build up your case list. And, I would give alternatives to surgery. And sometimes the women, after you counsel them, because that's what we're supposed to do, they might opt out of, getting surgery and want to try some non-surgical method first. And it was as if, like, You get the, oh man, you didn't get the surgery. That was good. I mean, I remember one day in the clinic, oh, that was supposed to be a slam dunk. That's how they saw our women, as procedures and not people. And I wondered, I said, well, I mean, it was to a point where when I would do my clinics, women over a certain age in Jacksonville didn't have a uterus. And I'm like, well, and so I would begin to ask, I said, well, why did you have your hysterectomy? Do you have bleeding, fibroids? And a lot of them would say, oh, they asked me, did I want to have any more kids? I said, no. Then they did a hysterectomy. And there were so many women. I mean, I just couldn't believe it. At first, I wouldn't believe it, but then I had to believe it because I would see these patients in my clinic as a resident who didn't have a uterus. And then when you're in the lounge or in the meetings and they talk about how, oh, we did, I mean, one doctor said he did over 400 hysterectomies one year. Now think about that. That includes nights, weekends, holidays. That's a lot of surgeries to perform, excluding those days. So pretty much it correlated with what the women were saying, and that they pretty much were just being coerced into have surgeries, tubal sterilizations without adequate counseling. And so as a resident, there was some resistance to not, what they call it, being aggressive enough to pursue these surgeries and cases. But, I treated the patient as if that was me or my sister or my loved one or my friend. I saw them as a person and not as a procedure. So to me, that is where um, diversity matters, because you can relate to the person and you feel like you've given the person every opportunity to make an informed decision. Like I did a medical ethics class some years ago, pre-pandemic, just as a guest lecturer at Edward Waters University, and we talked about ethics in GYN, and again about consent, sterilization via tubal hysterectomy. And I had a student after the class come and talk to me and said, hey, you know what? I did not realize that that was me, that I was violated all those years ago. I was young. I had a couple of kids. My future wasn't steady and stable. And of course, I said, oh, yeah, tie my tubes. Because in my mind, I thought it was like a shoelace you could just untie. And then later on, in my 30s, I was more stable. I was completing my education. And then I find out that now I couldn't have children anymore. Or if I wanted to attempt, it was going to be very expensive. So again, it is so important that we have people like us on the front line as providers, because you know it's a genocide, a sterilization of our people, because they make a decision. Oh, you're too young, you don't need any more children. Or, you're economically disadvantaged, you don't need any more children. Or I need to get some vaginal surgeries and your uterus is small, so hey, you'd be a good candidate. But never think about the repercussions or long-term effect on how removing or preventing future fertility has on people. So I think that having more representation uh, gives a more well-rounded approach to medicine, and I guess, and two, you know, treating the patients with empathy, because sometimes there's a lack of empathy when you don't have a connection. Definitely what I do now, I'm an OB hospitalist, and with the increase in maternal morbidity and mortality, I see the women who don't have a doctor, don't have care, or some even do have a doctor. And there's a lot of communication barrier. Sometimes you can reach a person from a different angle to get them to, take a lab result a little more seriously, decide to stay, decide to be admitted, because these are life and death situations. So people just don't, you know, they may not have a resource. And I'm saying, hey, we can get you in a doctor at Agape. Hey, we can get you at a doctor at Center for Women. A lot of times I feel like I'm a social worker. I'm handing out phone numbers. I'm handing out cards to people. I'm trying to go the extra mile to get a resource for somebody, because I don't want to see people undoctored and kind of left out there to the mercy of whoever their care provider is for the day. So definitely I think that having representation is just more than just a face. It's deeper than that. It's about making sure that our community stays connected and get the care that not they only they need, but they deserve.
Thank you so much for that. The what you did was articulate what it is to be a physician of color in and connect to the community that you signed up to serve. Those of you who may have joined this conversation late, I opened with some information about the Northeast Florida Medical Society and what it is we do. And one of the things that I suggested that we do is we bring together a community of physicians who are intent on improving the health outcomes for patients in Northeast Florida and South Georgia. And what you've described, Dr. Phoenix, is the impact of bias in medicine that begins at the training level as expectations are set around training, right? You want to attain certain skills, and it's not a patient-centered sort of endeavor at all. And then you spoke so eloquently about the opportunities that there are to provide holistic care if you see the person as a person. I had the opportunity to give a talk last week in Pensacola, where my parents still live, and what I said was, we have to put flesh on these bones, right? Because we're often quoting these statistics, right? But we only see them as numbers. Imagine each one of those statistics, put flesh on those bones, see them as people, and that should motivate you toward action in a different and more intentional way. I really appreciate the way you defined for our audience how that bias can show up, particularly in obstetrical and gynecologic medicine, and how it connects to some of the statistics that many of us are now beginning to see, be the headlines in the news. Really extraordinary comments. Dr. Pope, I want to give you an opportunity to respond. If there's anything you might share specific to the experience of being a Black physician, and then we're going to pivot to, what it takes to grow minority physicians and clinicians. Dr. Pope.
Yes. An example I'll give is, I guess, from another standpoint, and it happened in residency as well, but dealing with colleagues. And as a double minority, being African American and female, you definitely have to deal with those that may feel as though pediatricians may not know as much. They may be a little lower than a surgeon or a gastroenterologist or an ENT doctor. But what we do have to realize is that we are general practitioners first. And we learn the whole spectrum of the body. So my example was when I worked in the emergency room as a third-year resident, about to graduate. And I had a patient in a room where the person had a fracture of their arm. And at that time, we would do our own casting on the patients. So I had already spoken with the patient because I'm very bubbly and happy and, just trying to make them feel at ease. And of course, I am downtown in the heart of New Orleans, Louisiana, where there is going to be a lot of underserved clients. So I had already forged a relationship between me and the client. And because I'm a pediatrician, I have to forge more than one relationship, and that is with the child and the parent. So we're in the room, and then the specialist comes in. And the specialist just so happened to be a fellow. So a fellow is a individual who has completed their residency training of their primary disciplines. So, for instance, family medicine or pediatrics or internal medicine. And then they want to go the extra level and get another subspecialty. And so this just so happened to be an orthopedic fellow who was getting a specialty in another area. But Dr. Phoenix talked about doing procedures. And so because I was explaining the procedure and giving instructions and trying to tell them and make them feel, feel warm and, hey, this is how it was going to go, the orthopedic specialist felt as though I was taking over the case when I had already been the first person that that the child and the parent had seen. So we kind of got into a little tiff, which that's not something that I do in front of a patient. But at the time, he pulled me out of the room. And he did not want me to take care of the patient. So we went into the other room and I obliged him. But he proceeded to basically try to scold me in what I was saying and what I was doing and everything, and demean me as, oh, you're just a pediatrician, or you're just a pediatric resident, and you don't really know how or what to do. And you may not be strong enough to set the bone the way it should be set, because you're a female. And there were some other things noted that I won't specifically say that was demeaning, but that was the time when I had to take a step back and just think about, hey, how was I brought up? What would and what should I do professionally in this instance? I could have or wanted to run out and just, cry tears of a river, but that's not how I was raised. And I still had to take up for the people who were in the next room next to me, because they knew that I had the know-how to do what they needed done. So I had to stand up for myself and say, hey, I'm in this room too. And if you want to work together, we can do that. But what I'm not going to do is give up a patient who I have garnered their trust because you feel as though I'm either too little, too young, not experienced enough, when we can just work this thing together. And eventually it worked out in the favor of the patient, but sometimes we really have to gnaw, kick, and fight to make sure that that client is taken care of, because all he wanted was the procedure. He didn't see the flesh and the bones, or the flesh on the bones, like Dr. Tice said. He only saw that procedure of getting that the setting of that fracture done, because he wanted to check off the number on his procedure log to say that he had done that, whereas I cared more about the patient instead of the procedure. And I have to do that in everyday instances as well, even here in my position and other jobs that I have held. And not only there, currently in my own personal life. My father just was diagnosed a couple of months ago with a pulmonary embolism as well as double deep vein thromboses. So those are blood clots that he had in his leg and blood clots that he had in his lungs. And as I'm just sitting in the hospital room, I noticed as the doctors were coming in, they would come in, look, and walk out. And I would have to say, hello. come on back in. Let's have a little conversation. What's going on? What are your plans? What is your treatment plan? What is he doing? What medications is he on? What is your thought process? So they forget that they're coming in to see a person, and all they're looking at is an x-ray. They're looking at the numbers that they see or the labs that they are drawing. They're not thinking about the person, and they're not thinking about the family or the individuals or the support system that is around that person as well. So bringing more people into the health field, bringing more people into medicine who are aware of what's going on and aware of the questions to ask. And even if you're not in the medical field, just to know, hey, it's okay to stop someone and ask them what is going on. What is the next step? What is your thought process? What is my loved one doing? And can you stop and explain that to me? And so we, as African American physicians, know that in our heart that we have to be that person. I'm not going to leave my patient or let my patient leave out of the room without me explaining what I want to do for them and why. It's necessary to do that because you want them to have some form of understanding of what's going on. And then after you explain that, you want to say, well, do you have any questions? And that's all I needed them to ask me personally. Do you have any questions?
Right.
So that, we would at least know what was going on. But please, please, please don't be afraid to ask questions, because otherwise things could occur that you may not know that's occurring, or things may not be happening that should be happening.
Right.
So take advantage of that.
So important what you've described, and I want us to examine what both Dr. Pope and Dr. Phoenix have shared, both from the perspective of us as members of the medical society, as physicians who are a part of the healthcare system in whatever capacity, but also as with an idea or consideration for students who may be contemplating a career in this field. I want to acknowledge, I am no longer in clinical practice, and, my full-time job is focused on health equity. But the story you just told, Dr. Pope, proves that most of us have been in health equity work all along. Right? It was how we practice medicine, because when you don't practice medicine from a place of privilege, you inherently are looking to achieve equity, and that's not the case for those who don't have the same vantage point. And I remain astonished. I'm consistently and repeatedly astonished by the way privilege shows up in healthcare. Whether it starts with this concept of an executive physical, or which, is mind-boggling to me, or if it is the call that someone in leadership or in a position of power can make to pull strings to ensure that you get everything you need. Because our goal really is that everyone gets what they need, right? And we are doing all of us as physicians of color, we are doing double duty, right? You are taking care of your patients in your day job, but you are that physician advocate for anyone in your family who might be having a procedure. Lord, don't let anyone go into labor, right? You're up all night, right? They're sending pictures of the strip. You're in labor. You are laboring with them, because that is the reality of what it is to be a minority physician in an environment where we know there are disparate impacts. So that's really tremendously important. The purpose of our conversation was to make the case for minorities in healthcare fields. And, we've got 13% of the population that is Black or African American, and 4% of physicians in this country that are Black. And we have med school applications that have essentially remained fairly stable, especially for the Black male, over the last several decades, right? We are not gaining ground in improving representation, and it's really important. Not only do we have to support students, who may be experiencing the things that you've shared as residents, as med students, and as physicians early in practice, and organizations like ours do that, but we also have to sort of look back and do what we can to ensure that students are prepared to attain the acceptances into undergraduate programs as well as medical education programs. How soon, how early, at what point do you think it's necessary for us to start influencing the next generation of potential healthcare professionals? Where should we capture them, and what does that need to look like? We'll start with you, Dr. Pope.
Ooh, that is a loaded question. I would say from the very beginning. So me being a pediatrician, I'm going to say from childhood. I don't know if you all have heard of Doc McStuffins, but Doc McStuffins is a fictional character, cartoon character, who acts as if she's a doctor to her stuffed animals and things in her house. And she has the entire kit, has her own clinic outside in the shed, and kids love that. So, turn on that cartoon. Think about that when, your children are saying, hey, I think I may want to be a doctor, or I may want to be a nurse, or this, whatever in the STEM field. Give them a stethoscope. Allow them to utilize it and listen to you, but start as early as possible, especially from the time that it comes out of their mouths, that they're thinking about it. That's when you jump into gear and start creating those possibilities and opportunities for them. So, you're thinking about it? Well, let's research. What type of things do you like? Do you like kids? Do you like adults? Do you want to do surgery? Do you want to be in, general practice? What type of things do you like? So you start doing that research early. Who did you see that you liked? So they may have somebody in mind that they saw. Start there and then move forward. Talk about shadowing. I think both of you all, Dr. Tyson, Dr. Phoenix, mentioned that earlier. Shadowing, doing internships as well. If you know a physician, if you know a physician assistant, a nurse practitioner, those that are all in the field seeing patients, reach out to that person and say, hey, can I spend a life and a day with you, Dr. Phoenix? Can I spend a life and a day with you, Dr. Tice? I just want to see what you're doing, because that's going to give you the opportunity to see if this is something that you really want to do. Those internships, and they have paid internships and paid summer programs. Never once did I pay for a summer program. Now, these days, because there's so many individuals who want to go into the field, a lot of times in junior high and middle school and high school, there may be some opportunities that you can pay to have, but then there's a lot of vast opportunities out there as well that afford you the opportunity to go to different hospitals, to go to Agape, the health department, St. Vincent's Baptist, work at Blue Cross Blue Shield as interns. Just following those people who you want to, or who you admire, or the different fields that you want to be in. And if they don't have that particular field, it's okay. Follow who they have. You never know. You might figure out something that you may like and didn't know that you could tap into, but at least you will see the actual day in the life of a clinician to see if that's something that you might want to do.
That's great. You know, you'd be like Dr. Phoenix and be like, I don't know what I want to do, but I know I don't want to do this. I felt that way with my summer internship at the Environmental Protection Agency. I was like, oh no, Lord, no, this is the land that time forgot. I cannot stay here. And so that's super important. Dr. Phoenix, would you have anything to add to that in terms of, you know, how soon and what needs to happen to set young people on a career path toward medicine?
Definitely, I agree with everything that Dr. Pope had to share. It's never too soon. And also tap into, what is necessary to uh, become a physician. Once you have the interest, definitely the interest is there, but there's going to be dedication. There's going to be some time sacrifice, but it's attainable. You have people who say they want to be a professional athlete, even though the odds are very slim, but people still feel it's attainable. Mm-hmm. We should have that same level of desire with medicine or other STEM careers. Yes, it's going to require a lot of, it's not necessarily practice having a trainer, but you're reading, which is practicing, you're studying, you're taking exams. So it's the same type of rigors, just for a different outcome. So we just need to see it as a feasible goal, that once you graduate and you pass your boards, it doesn't matter if you're the first in the class, the middle in the class, or the last in the class. As long as you succeeded, you passed your boards, you have the same medical license as all the other individuals. So it's just persistence, there's dedication, there's hard work, it is doable. Definitely seek out a mentor. I was the first physician in my family. So it was definitely important for me once I linked up with other classmates of mine. A lot of them were the first physician in their family, that we had our own network that is attainable. That, there is a financial cost. However, a lot of your state medical schools are most affordable, and they're looking for people who are from the home state to apply, because you're more likely to either work in that state or service the needs in the area. So a lot of times people get focused on huge name schools. Oh, I want to go to UCLA or NYU or UMass, but again, the boards and exams are all national exams. So looking to see what your state resources have. There are definitely medical shortages in the South. I know there are programs that are trying to start as early as getting people accepted into college medical school acceptance to try to fill the needs. So do your research. There are different avenues to try to implement getting minorities in medicine and just Americans in medicine in general. Because once the boomers retire, then there's that next group, Gen X. Once we retire, then the shortages of physicians are going to increase. So this definitely is a time to seek out the resources, research, definitely attain a mentor, again, shadowing, internships, volunteer. You gain a lot by actually the unpaid work that you do. I mean, you may not necessarily be doing patient care directly, but you may volunteer with billing. You may volunteer with patient transport, just to be in the environment. May put you in contact with someone who can take you to the level that you want to go to. So always seek out an opportunity to make yourself available. We usually have local health fairs, and that's a time that you can actually meet a physician one-on-one without an appointment. So I would say definitely when you have those community health fairs, take your kids and go and speak to the doctors at the booth. That'll be an opportunity for a connection that can put you on the path of success.
What a great idea. What a great idea. I'm I always have such concern about health fairs because I don't like the idea of folks utilizing those screening events as their care, right, or as some sort of reassurance that that they don't have any health concerns. Um, and we do a good job with the health fairs that we participate in by ensuring that we provide a linkage to care if we should identify an abnormality. But the opportunity to connect one-on-one with a physician without an appointment is really tremendous if you've got a child in your family who may have an interest in that as a career. So I love that. I also think that what you describe about finding a mentor, getting exposure, spending a day with something that has been sort of a major tenet of our organization since its creation decades ago by physicians who actually are still in this community. And never have I had a member of our organization get a request from friend or family member, can my daughter come and just sort of shadow you for a day or that sort of thing. Never have I been met with no. I think it is a part of our DNA, a willingness not just to have them or host them in your office, but to use your resources and connection to connect them to a physician, maybe in the practice area or specialty that the student might have an interest in. And so I'm really proud of that, and I know that that's necessary. So this conversation, we're going to bring it to a close, but know that I don't think we could have done anything better than we have been able to accomplish in the last hour or so to kick off our week of giving. We have a goal of $25,000 that we want to raise for scholars in the Duval and Clay County areas, for students who are interested in health, studying in the health field. We have a number of applications that are being scored and reviewed, and we want to be certain to put money in the hands of these local scholars as they move on to college. So please do remember to click the link and donate today. This recording will be posted on the Northeast Florida Medical Society website, nefms.health. It will also be on the YouTube channel, and the link will remain live. So if you don't have your ducats in a row tonight to be able to donate, it is not too late. We will still accept any funds you'd be willing to give. Please share this recording with your friends and loved ones in your circle of influence, so that we can move toward this goal. Thank you so much to my esteemed panelists, Dr. Akilah Pope and Dr. Ava Phoenix. You did an extraordinary job of painting the picture of what it is to be you, and I am grateful. And of course, final thanks to the original hosts of Pause for the Truth, Dr. Rogers Kane and Jocelyn Turner, who yielded their platform to give us the opportunity to use it to kick off our week of giving. Please give today the 2024 Minorities in Medicine Scholarship. Thank you so much for your time and for the conversation. Have a good evening, everyone.